Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. Aches, pains, and injuries all come with playing sports and being active. Today, we'll be talking about how to treat and prevent these problems using different forms of physical therapy. We'll be discussing all different kinds of therapies and what they can do to make you feel better. Now, joining us today is Dr. Lisa Corsa, physical therapist, manual osteopath, and athletic trainer of Premier Therapy Solutions. Welcome, Dr. Corsa. Thank you for being here.
Good morning. Thank you for having me.
Okay, you have quite an extensive list of credentials and certifications. So you have a doctorate, a master's degree in physical therapy, a PhD in osteopathic clinical sciences. You're a member of the American Academy of Orthopedic Manual Therapists, plus a whole bunch of other memberships and certifications. So obviously you're passionate about this field.
Absolutely.
So what got you interested?
Well, when I started at University of Florida, I was volunteering with the football team, and every time an athlete got hurt, I would always be on the field trying to see and assess what was wrong with them. And I loved how simple it was to get the patient back to health. It was so exciting, and I just really enjoyed, so it was really my alma mater, University of Florida, that got me into physical therapy.
Okay, my next question is, what is osteopathy? For our viewers at home who don't know, what is that?
So it's a branch of manual medicine that treats and looks at the body as a whole. And it works on the joints, muscle imbalances, ligaments, soft tissue. So it really uses manual hands-on skills to fix deformities.
And it's a specific kind of training or physical therapy, correct? You have to learn certain techniques for this for osteopathy?
Correct. It's a separate branch off of physical therapy that you can take additional training, which I did, and you work on a lot of these different imbalances.
Amazing. Now today we're talking about the benefits of physical therapy, and we have a video here of an athlete who competes in duathlons, which is a race that consists of running and biking for Team USA. So let's hear her story.
To me, this is very serious, to take care of myself and to stay active. I thought it was time to have my knees looked at again, that I was experiencing quite a bit of pain. So I saw a doctor and then had the care team review what would be the best situation for me. I plan on competing in the National Duathlon Championships that'll be held in St. Paul next summer. It involves running, biking, and then running again. That's where I need to know the roadmap on my knee and what I can expect, what I can do, and what the breadth of treatment is. As I continue in my years of competing and working out, I do have, challenges that are going to be coming up, and that I want to be in the best physical shape that I can be. Mayo's reputation and their staffing and their professionalism is outstanding. They'll spend the time, they'll take the time till they feel that they have addressed your needs. And that's a very welcoming feeling. It's so much a part of me for the last at least 30 years, so it is me. It is who I am. I feel so young.
Go Team USA. Now, I know you have different patients that you see, but you see athletes like this in your office?
Absolutely. These professional athletes or even collegiate athletes, we very often treat, and they're really exposed to these repetitive stress syndromes.
Right.
They're constantly working out day in and day out, and the muscles just get impaired.
But I think more importantly, they don't want to stop competing. So
Correct.
I'm sure that's something that you have to evaluate as well.
Correct. They don't really know pain.
Right.
They don't understand pain. They just push through it, and really they end up doing more damage.
Right.
So we focus on how do we treat the pain. We also focus on preventing the pain before it comes. So like with our professional athletes, we will do a sports recovery treatment post-football game, post-tennis match, even when they're not in pain, to prepare their muscles for the next day.
That's a great way to do prevention right there.
Absolutely.
Now, we have a list here of some of the goals of physical therapy, and we'd love to talk about these, Dr. Corsa. Tell me about what the 4 main goals are.
So obviously, the patient usually comes in for pain management.
Right.
They're in pain of some sort. We usually assess, look at the entire body, treat it, and figure out what is the root cause, and then I attack the root cause. The other one is sports injury and recovery. So these are these weekend warriors, or they could be the collegiate and professional athletes. We talk to them about how do they recover their muscles. You've worn out, you've just played 8 hours.
Right.
We've got to focus on this. Prevention is key. How do we prevent them from getting hurt? Muscle balance is key. Most of these tennis players, they have the strong dominant arm and the weak, other arm. It's a real problem. So I educate them on strengthening both sides of the body. Then we talk about the age-related injuries. You know, these baby boomers, we're getting older. We start needing knee replacements, hip replacements. How do we prevent those issues?
Right.
That's really important. And then eventually, everyone always asks me, I'd like to avoid surgery. Surgery is the last resort. Physical therapy can drastically avoid surgery. It's one of our, forefront, one of our mantras of physical therapy.
And that's what I want to focus on, because I think any patient who comes in, the last thing they want is surgery. They feel, oh goodness, I'll be out, I can't compete. So how do you really focus so a patient avoids surgery?
The most important focus is looking at the musculoskeletal system and balancing it. It's really important that the structures are balanced, because that's what really a lot of times causes surgery. Knee arthritis, shoulder arthritis, it's when one muscle is pulling too strong against the weaker muscle, and it's this battle.
Right.
So the bone rubs against the bone. And identifying these posture-related injuries, now so often sitting is the new smoking. Everyone is sitting these days. The rounded shoulders, the forward postures, everyone's in airplanes, long travels, causes a lot of injuries. So just preventing by looking at the body as a whole and educating them on no smoking, eating right, maintaining a healthy BMI. Those are all ways to avoid surgery as well.
Absolutely. We're going to talk more about those a little later. But let's say someone does need surgery. So tell us why a patient would need therapy both before an operation and after an operation.
So my prehabilitation approach is very unique. It is a clear-cut approach that identifies the shoulder joint, or say they're getting a knee replacement, and I look at those imbalances. I will fix the imbalances prior to surgery, because let's face it, for a knee replacement, the doctor's really going in and just cutting the bone. They're doing a great job at fixing the bad arthritis.
Right.
But I'm actually going in and fixing the muscle imbalance before they go in for the surgery. I have a lot of anecdotal data that if you do prehabilitation, your post-op rehab is a breeze. Most people obviously do need rehab after surgery.
Of course.
We've got to control the swelling. We've got to control the pain. This is really important. So I focus a lot of that immediately post-operatively and get them back to walking.
Now, I really definitely want to talk about your practice, Premier Therapy Solutions. You have a medical concierge program. That already sounds fancy, and I love it. So tell me a little bit about this program, and how important is it to provide this to your patients?
So I started the medical concierge program with one patient who had had a back surgery, and they had operated on the wrong level. And she had a lot of issues post-operatively. So I created this program which basically examines your entire medical history from beginning to end. I put it together in a nice brief summary timeline, and then we help to try to find the right physicians of who you need. Might be a urologist, it might possibly be a cardiologist, or you need an orthopedic surgeon for your knee replacement.
Right.
Then I get them to the proper surgeon. I go with you to the appointment, ask the proper questions. Most of these patients don't know the clinical questions to ask, or they forget.
Or they're overwhelmed.
They're overwhelmed. They can't take notes. What do I need to take? Then you start dealing with polypharmacy. A lot of doctors are talking, and they're not speaking to the other physicians, and everybody's prescribing different medications. A lot of the polypharmacy can lead to falls. Falls among the elderly is a big problem. Balance issues, they fall and break a hip. So this concierge program, I speak to all the physicians, we collaborate, and then I even go into the operating room with you.
That is such a unique factor of your program. Tell me, why is that important for you to be there during the operation?
So I'm at checks and balances for both the patient and the surgeon. The surgeon actually likes that. We kind of make a checks and balances. We answer all of the questions. We cross the T's, dot the I's. The patient feels secure. They have a sense of calmness in the operating room, which brings a really great post-operative outcomes. I just make sure everything is done correctly, and it's a win-win on both parties.
And this concierge program is not just limited to your practice here. You travel all over the world, South America, South Africa, China. Tell me why.
So patients, obviously the word has gotten out, and so I travel all over the world to help patients seek proper care in their hometown.
Right.
Most often, you're right, they are overwhelmed. They don't know who to ask. So it might even be me just going there and telling them which type of physician they need. You know, look, start with your primary care. The primary care will direct you to a urologist or to the cardiologist. So it's really neat that it's taken me around the world and have helped people all over.
That's a beautiful thing. But also, I think it's important to note that this kind of communication between all doctors, this is one crucial aspect of this program. And why is it important so all these doctors and the patients are all on the same page?
That's a great question. Collaboration and communication is the key to success.
Absolutely.
And most often these doctors do not have time. So I allow that time. I get them together in one room. I make sure they're all speaking. We know the case, and it really is time. I am that person to sit them down and say, answer these 10 questions, and clear and concise. So we're not wasting people's time.
Right.
And that's the key to the exceptional outcomes that I get.
Absolutely, making it less frightening for the patient as well. Now, up next, we'll be talking about some different types of therapies that may help ease pain and get you back up and moving. So stay tuned to hear about manual physical therapy, integrative physiotherapy, and even aquatic therapy. I like that one. You're watching the Health Channel, all health, all the time, on South Florida PBS. If you have a question for Dr. Corsa, please call in using the toll-free number, 855-796-4475. Please be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes or submit questions for the experts. We'll be right back.
I was too young to get a mammogram, and I had no family history, and the lump was probably just nothing.
And I sat in that waiting room talking to women, and there were about 10 of us, and I casually joked with another woman, I can't believe that 1 in 8 women will be diagnosed in breast cancer. There are 10 of us in this room today.
Yo sabía que iba a regresar positivo.
She was fairly certain that I had breast cancer.
When I heard my grandmother was sick, I knew I had to take care of her more.
I heard the 3 most horrific words anybody could ever hear. You have cancer.
They were giving me life-changing, devastating news, but at the same time, they were giving me a plan.
I felt very blessed to be here in Miami and to have a network of doctors.
Cancer treatment is ugly. The way Baptist treats you as a person is beautiful.
I just knew in my gut that I was going to be okay.
When you finish radiation, you ring a bell. Pretty much the entire staff of MCI showed up.
Your dream team is out there.
Las siento como unas personas como amigas, más que doctores.
If I waited, I wouldn't be here today. Early detection is incredibly important. Know your body. Go and see your doctor, get the mammogram, get checked.
I can't stress enough how important it is to be your own advocate.
Early detection saved my life.
So many people helped me, and now it's my turn to give back.
There's part of myself that I had lost, and I found it after.
Mis experiencias en Miami Cancer Institute han sido muy buenas. Los tratamientos han sido sensacionales.
Miami Cancer Institute is Disney for cancer patients.
Embrace tomorrow.
Programe su mamografía hoy.
Abraza el mañana.
Schedule your mammogram today.
A smile. It can show how we feel. It can change the course of our lives. But what would life be like if you weren't able to smile? It doesn't have to be this way. Since 1999, Smile Train has been helping children experience the simple joy of a smile. To learn more, call or go online now.
It is the most amazing gift that you can give someone. It's seeing individuals have an opportunity of their lives that they would never have again.
Welcome back to the Health Channel, All Health, All the Time. I'm Kathy Buccio, and with us is Dr. Lisa Corsa, physical therapist, manual osteopath, and athletic trainer at Premier Therapy Solutions. If you have a question for Dr. Corsa, please call in using the toll-free number 855-796-4475. We'd love to hear from you. Now, let's talk about some of the different therapies and services that not only treat pain, but prevent it as well. And one of these, we've already spoken about a little bit of the osteopath, and now we're going to go through each of these points. So talk to me about these different therapies and services that you offer.
So the manual physical therapy is a very intensive, laborious type of therapy we utilize that mobilizes all of the joints of the body, or the injured joint above and below. So for example, tennis elbow and golfer's elbow. It's very difficult to treat at times because people just kind of throw a bag of ice on there. But often they need manual therapy where we actually manipulate the bone, both bones, to mobilize and create more blood flow, more fluid in there, and that's a very effective therapy.
We actually have a short video showing us some exercises you can do to prevent injuries like golfer's elbow that you've been talking about. So let's take a look at that.
So today we're going to be talking about tennis elbow and golfer's elbow. And they're basically common complaints that we see in clinical practice very often due to the fact that people are active playing sport. But even though the name suggests that it's caused by golf or tennis, in fact, it actually really isn't. The condition on either side, golfer's elbow affects the medial side of the elbow, and tennis elbow affects the lateral side of the elbow. So we have lateral epicondylitis, or medial epicondylitis are other terms that you may have heard for these conditions. So I'm going to demonstrate the exercises I was talking about using a golf club. You could use a tennis racket, you could even use a broom or a mop handle, something that you have at home. All right, so we're going to keep the forearm stabilized, so elbow bent at about 60, 70 degrees, forearm resting on the bed or on a tabletop, and literally just rotating through, holding at the end of range, nice and slow and controlled with the movement as we go. Forearms in the same position, stabilized on the table, and we're simply moving up and down into wrist flexion extension, and then turning over, again through full range wrist extension and flexion. And in this position, we're working the wrist extensors. If you can perform these exercises to keep the muscles strengthened and perform the stretches to maintain the flexibility, then it's going to very much reduce your risk of developing these painful conditions.
Now, I've heard of tennis elbow, but I actually had never heard of golfer's elbow. So, as we saw here, with one of your therapists, is it treated the same way, differently, correct?
Correct. It's actually on the opposite side of the elbow.
Okay.
So one is on the outside and one occurs on the inside. Golfers occurs on the inside. It's a similar treatment, although the manual therapy is different. So that's where those manipulations and mobilizations of the joint are very different and unique. And for those type of therapies, I truly believe one of the missing links, you do need to treat above and below the injured site as well.
Not just on the injury.
Correct. So everybody always just focuses on the elbow, but our approach is you definitely need to look at the shoulder and the wrist as well.
Why?
Because it's all involved. It's all one kinetic chain. When you do a golf swing or a tennis swing, you're utilizing the entire arm.
Right.
It's just that the painful site occurs at the elbow.
Now let's go back to the graphics. We have some other therapies I want to go over, and one on there that you and I were talking about off camera is aquatic therapy. So tell me a little bit about aquatic therapy and how it works.
So aquatic therapy is used for absolutely not only orthopedic conditions, but neurological conditions as well. Almost every patient can go in the pool. I have a really unique pool that has a special elevator that can lower you down to any depth so we can change the buoyancy. A lot of these people with arthritis, their knees are aching, their hips hurt so bad. The pool, the buoyancy of the water, they have no pain in the water. They can walk freely. A lot of our Parkinson's patients that stutter and can't walk on land can walk amazing in the water. They're incredible with their gait pattern. The water is a godsend. We put it at a therapeutic temperature of 89 degrees, nice and warm. And we have specialty cameras that can identify the deviations, and then we correct the deviations. It's fantastic. We're using it for stroke patients that are paralyzed on one side, and my team actually goes under the water to physically move the limbs on a treadmill.
And now when they're in the water as well, this loosens up the muscles?
It loosens up the muscles. It creates more blood flow. It creates this balance of synovial fluid that we lack as we get older. And it's incredible how they feel less, stiff. They ambulate better, they get out, and a lot of their aches and pains are gone. It's an incredible modality.
So many benefits to aquatic therapy. We do have a graphic showing some of these benefits, and if you can go over these, Dr. Corso, that would be so helpful for us, starting with the hydrostatic water pressure.
So as I discussed, the buoyancy, so someone who's very heavy, a lot of the obese patients, heavy BMI, the hydrostatic water pressure helps to reduce the weight bearing on your joints. It's very effective. It improves the muscle memory. So when you go and walk on land, and a lot of these, like I said, Parkinson's patients forget how to walk, you actually go into the water and the body remembers how to walk normally. There's less physical sensation, so they don't have the stress and strain from the tension of the muscles on the land. So the tension of the muscles is less in the water. Absolutely better blood flow.
Yes.
A lot of these patients have stagnated fluid, swelling in their ankles, venous insufficiency, varicose veins, the blood doesn't move. Aquatic therapy drastically improves the circulation and easily accessible to any patient, paraplegic, quadriplegic, patients that are wheelchair bound can get into a pool with special lifts.
Now, how often do you have to be doing these therapies to see results?
Great question. I would say roughly between 2 to 3 days a week. It's really important. You don't move it, you lose it.
Right.
It's the truth. So getting up and doing something every day, whether formal physical therapy or just at home walking, is the key to longevity.
Even if it's just a couple of steps, even if it's just a walking to the mailbox.
Absolutely. I say, you're in the grocery store, park the furthest spot away. Take that long walk, use the cart, walk through. Mobility is freedom.
Absolutely. Now, another treatment that is sometimes used in addition to aquatic therapy is something called cupping. So let's take a look at how it's done and how it helps relieve pain.
Many of you may have seen the swimmers as they come out of the pool with the large purple circles that they have on their chests and their shoulders and even down their legs. And you're probably wondering what it's all about. Well, it's attributed to a method of treatment that we call cupping therapy. So it's been around for thousands of years. Actually, the ancient Chinese used to use it using small bamboo cups that they would put heat inside of it, put a flame, and then they would put it onto the muscle tissue. Whereas these days we've come up with more modern techniques for doing it. And it's widely used throughout physical therapy practices. So I'm going to explain a little bit about how cupping therapy works and how we utilize it to relieve a wide variety of symptoms: pain, stiffness, chronic pain, chronic conditions, as well as acute conditions can all be treated using cupping therapy. And there's two actual treatment types that you can do for cupping. So we do what we call a static cupping, which is where the cup stays in place. So we apply the cup to the skin that has the moisturizer on it, apply the cup as I demonstrated before, and then simply by performing the suction, it lifts the skin and the soft tissue up. Now the second form, as I said, is we would do more of a movement of the cup and do a massage. So we apply the same principle in that we attach the cup, we lift the skin, but to a much lesser extent. And then from here we can actually move the cup around and we're massaging as we go. So still drawing up the skin, as you can see, along where the cup is placed, and we're doing a massage and treating over a specific area. And you can see clearly here that we're drawing up some of the toxins away, and some of that redness is actually coming out under the skin from the suction force that we're applying. So if the success of the Olympic swim team is anything to go by, our patient here is going to be back in the pool and swimming like a champion in no time.
Okay, I was literally mouth open watching that procedure, and we've seen it in Michael Phelps. We had even some celebrities made it famous, Gwyneth Paltrow, Jennifer Aniston. So what is cupping and why it works for swimmers? Explain to me that sucking of the skin.
So yes, as my senior associate said, it has been around for so many years in Chinese medicine. And what's great is it moves stagnated fluid. Again, when you don't move it, you lose it. So the tissue, the blood flow, everything gets stagnated. So when you suck up the skin, you're also sucking up some of the fascial tissue, which is this thin layer of connective tissue that sits right under the skin, to help release the pressure, to remove the dead tissues, to remove the dead fluid and improve the circulation. It's a fantastic modality, not just for athletes, but again, those weekend warriors that are out there and, you know, played softball with their friends or basketball. Oops, I strained my calf and now I've got a spasm in my calf. You know, or the people that are kind of going to the gym and they only have time, they go once a month and they work out for 6 hours and they hurt their neck. So I'll put the cups on the neck, the muscles of the neck. It's just incredible. It works well.
And I understand that you as well have used this in your own practice.
So I use it very often. We use it on our own patients. We use it on our own self.
Right.
Because we are constantly doing manual therapy and using our hands. So our muscles of our forearms get sore, our neck gets sore. So I'm all about prevention. We do not want to get bad spines, herniated discs, leaning forward like our job does. So we cup our necks all the time.
Okay, so I want to talk more about some of the other therapies, and one of them is called a muscular balance evaluation. What is that?
So in my practice, when I evaluate patients, I look and often say, why did you get this injury? Well, they got this injury in the first place because their muscles were not balanced. So it's a head to toe, soup to nuts, full body assessment that looks at every muscle in the body for balance, length, balance, strength, weakness. I identify the weaknesses, the length relationship. And it's so unique because I can give you a prescription to say, stop doing that exercise, you're too strong in this muscle. Or I'll say, this muscle's too weak, or this muscle's too strong. So it's literally a prescription for prevention of health and prevention of further injuries.
And it's a prescription for each of your muscles specifically.
Absolutely. It's very detailed, kind of a unique analysis. I put you on special machines, and you'll come out of there knowing, wow, if I don't do this, I could potentially have some arthritis later on.
Right. Now, CBD therapy, what is that?
So we started getting into this. This is the big movement. You know, the CBD, everyone's kind of teetering around with this. Okay. Is it effective? Is it not? A lot of these patients are using it for Parkinson's disease, to reduce tremors. There's some evidence in the literature for seizure disorders. It's kind of a liquid they put under the tongue. It's a type of cannabis oil that we put under the tongue that is approved now for tremors, or for anxiety, for sleep. So a lot of the neurologists are prescribing this now. You definitely would want to recommend this. Go to your primary care or your neurologist to see if this is indicated for you for some specialty conditions like Parkinson's, anxiety, and sleep.
Now, what kind of patient would use this?
So some of my patients, we offer CBD cream. We put it on osteoarthritis of the knees, and it helps with some arthritis pains. Definitely patients...
Doesn't take it away.
Correct.
Let's emphasize that.
Correct. Is it actually curing the disease? No, it is not. But it's definitely helping to treat a symptom, treat some inflammation, treat the pain. But you must definitely check with your physician first before trying it.
Okay, now we have a lifestyle assessment, which sounds like what it is, but what is an assessment?
So my lifestyle assessment takes into account nutrition, your blood work, your sleep. Are we really getting 8 to 10 hours? Are you really eating healthy?
Right.
Are we avoiding the sugars? Then I look at, you know, the body as a whole. Are you having difficulty focusing and concentrating? Are you spending 8 hours a day on an iPhone? The difficulty focusing with your eyes. Nowadays, you know, everyone is using these tablets and smartphones. They're leaning forward. They're really difficult.
They've become an extra organ in her body right now.
Absolutely. I'm now seeing 15-year-olds, 12-year-olds with texting neck. I did a segment on that. They're all getting neck pains, and their necks are looking like 40 and 50-year-olds from bending over and texting.
And we're going to go into that in our next segment because that is a big one.
Big problem. So the lifestyle assessment really takes into account all of those factors. And I sit down, it's a couple of hours, and we go through, again, giving you a prescription of health.
Now, how much of that lifestyle assessment is tied into preventing injury and helping injury?
Yeah, that's great. I will look at how many of these patients in my lifestyle assessment do they really have injuries that are waiting to happen? So that kid that's carrying the 30-pound backpack in college is definitely going to have a shoulder injury or maybe some scoliosis, which could be a spine curvature, which we could prevent. So I look at that and say, you need to stop carrying this backpack. Or I get the traveler, the CEO who's on the airplane carrying the heavy luggage. You've got to reduce that luggage. So I will say you need to stop doing this, and I give you tips and ideas. There's a lot of good ways. Changing your smartphone, tablet, when you're in your airplane, you know, they sell those unique tablets that you could put upright so you're not looking down. Everyone's reading books down. So both of that assessment is definitely 50% prevention and then 50% helping the actual problem.
Now, we've been talking about all different kinds of therapies, and up next, we're going to focus on a specific body part where a lot of people get pain, and that's the back and the spine. You're watching the Health Channel, all health, all the time, on South Florida PBS. If you have a question for Dr. Corsa, you can call in using the toll-free number, 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes or submit questions for the experts. We'll be right back.
Hurricane Florence made a direct hit on the Carolinas, causing wind damage and widespread flooding. As the floodwaters begin to recede, Allstate mobile claim centers are canvassing the Carolinas to assist people affected by the storm.
We have mobile claim centers set up throughout the entire area so that people can come to us and they can start the paperwork. And in some cases, if they have a covered loss, we can cut them a check on the spot or deposit money into their accounts.
Learn more at allstate.com/recovery.
A smile. It can show how we feel. It can change the course of our lives. But what would life be like if you weren't able to smile? It doesn't have to be this way. Since 1999, Smile Train has been helping children experience the simple joy of a smile. To learn more, call or go online now.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. And with us is Dr. Lisa Corsa, manual physical therapist, osteopath, and an athletic trainer at Premier Therapy Solutions. If you have a question for Dr. Corsa, pick up the phone. The number's 855-796-4475. Now, we're talking about physical therapy today, and for this segment, I want to focus on the back. Why do so many people have back problems?
Well, absolutely. It is a huge epidemic. Because sitting, again, as I mentioned, is the new smoking. We're all sitting. We're all on our iPads. We're all flexed forward. It is a major problem. I treat backs every day, and chronic backs as well. So I think the key importance to back health is prevention. Knowing the problem before it happens, catching it before the pain. And that's where I've turned my practice into, preventing the back problem.
Now, for athletes specifically, what kind of back pain, back problems do you see?
So for professional athletes and collegiate athletes, they are definitely getting back problems from overuse. You know, they are using their muscles 10, 15 hours a day. They don't let them rest. They don't let them recover. So I see a lot of muscle strains, herniated discs from overuse, gymnasts, extreme posturings that are blowing out their discs, tennis players that are herniating, tearing their ligaments. It's a real problem.
I want to shift gears a little bit and talk about a different condition that causes back pain, and it's osteoarthritis. So what is osteoarthritis? Can you explain that to our viewers?
So osteoarthritis is absolutely the wear and tear of the bones and the cartilage around the bones. It can happen in any joint, often the knee and the hip. That's why patients get hip replacements or knee replacements. But it is quite common in the spine. As we stand all day or we sit, the spine is getting degenerative. It loses blood flow. It loses the circulation. Hence the reason you should get up. The 30-minute rule. Get up every 30 minutes, walk around, go to the water cooler, get a glass of water, a cup of coffee, move. You have to move to lubricate the spine. That seriously helps to prevent osteoarthritis.
We have a graphic showing osteoarthritis, and I want you to talk to us a little about what we're seeing here exactly. What is happening in the spine?
So in the section for the normal spine, you see the nice bright blue discs. They're hydrated. They're a gelatinous material that's in between the beige bones. Those are our bones. That nice gelatinous material, as we age, we lose water in the discs. So every night we go to sleep, the water replenishes. So when we stand up, we're actually taller again. But day in and day out, we don't sleep well, we have problems, we strain our back, we bend forward too much. The water is lost. The graphic there with the red spine. Those discs are degenerative, and this can start, I'm seeing it in my practice, as early as 18 and 20-year-olds. Because
shocking.
All they do is sit all day. They're studying, and sitting really puts a lot of force and torque on the back.
You know, my daughter's school has this thing called flexible seating, and it's for students, so they're not sitting in the same desk at all times, sort of move around the classroom, pick a spot, stand up, move around, so they're not in just one position all day.
I love that. If we could adopt that everywhere, again, the 30-minute rule, that's fantastic. Just getting up every 30 minutes, you're really lubricating your spine and preventing arthritis.
Now, we do have a short video from the Mayo Clinic that explains the different ways to relieve pain for osteoarthritis. Let's take a look.
Sore hips, knees, or shoulders. Arthritis in those joints can be painful. Dr. Eric Madison, a rheumatologist at Mayo Clinic, says,
arthritis is damage in the joints.
One kind of arthritis comes with aging.
Osteoarthritis, or wear and tear arthritis, the kind that most of us are going to get as we get older.
Dr. Madison says the pain can affect a person's overall quality of life. He says lifestyle choices can affect a person's risk for getting arthritis.
Physical activity, minding your weight, smoking cessation is important because smoking is actually related to developing arthritis as well.
Over-the-counter pain medications may offer relief.
We try also to have patients do things beyond taking medicines that will relieve pain. Being physically active, using heat or cold sometimes when the joints are especially uncomfortable.
Being physically active is key here. Now, when you talk about exercises like yoga and Tai Chi, are those helpful?
Absolutely. Those help to lubricate the joints. So any movement is so effective for preventing arthritis or muscle pains, aches, strains. And Tai Chi recently has been really indicated in the literature to help with Parkinson's disease. It's a fantastic modality for balance with the older patients.
I see older people do a lot more Tai Chi. It seems like it's a slower paced form of exercise.
Correct. It's very slow moving, a lot of balance, standing on one leg, very effective. A third of adults over the age of 65 have falls.
Right.
Falls among the elderly is crucial because it can cause a fracture, and then a fracture can lead to surgery, which could ultimately lead to death.
Right.
So it's very important we focus on balance, and yoga and Tai Chi help with that.
All right, I'm going to shift gears. We're going to talk about TexNeck next. Now, we're talking about back pain. We should also mention the neck because a lot of people experience pain there as well. Now, check out this video from physiologist Dr. Ronald Tolchin and what he has to say about a condition called TexNeck.
TexNeck is a condition usually seen in younger people between the ages of 18 and 44. It's almost actually at an epidemic proportion. Up to 79 or 80% of individuals in that age range have difficulty with neck pain. And what they found when they look at the behaviors of those individuals is that they bring their head forward when they're texting, and they could text from 2 to 4 hours a day. Not all constantly, although some for more than 1 hour. And if I can show this position, they're in their phones like this with their neck bent about 60 degrees forward. And they're looking down the whole time, and before they know it, they have neck pain. We found that it's attributed, in many cases, to our high-tech world right now, whether it be a computer, a tablet, or a smartphone device. Complaints of patients with TexNeck is usually neck pain that's non-radiating in the back of their neck and up to the shoulders usually. They have shoulder pain and stiffness in their shoulder. So we want to try to make the device at eye level. Secondly, we want to try to limit the time they're in that position. So we want to have them take more frequent breaks. I know we're not going to curtail the habits of texting in this day and age and using the computers for extended periods of time, but it's important to break some of the habits, change position, have them take a break and get up and walk around and then come back to it so now they start to stretch. And then I often give them exercises to supplement that.
So this is definitely something I've been trying to do myself. Try to do a little more of this. But I'm actually terrified for my kids who are born into a society of iPads and phones, and it's this.
Absolutely, and that is the correct way to keep it out eye level,
eye level.
So you're not flexing your neck, like the physician said, 60 degrees.
Right.
I mean, I'm seeing patients 12, 13 with neck pain, multiple muscle spasms in their neck that they don't even know what it's from.
What do you do?
100% it's from the phone.
Right.
We've got to do a lot of soft tissue, manual physical therapy. A lot of heat packs they sell over the counter are very helpful. Teaching them postural education, lying flat to prevent them from curving forward is an excellent modality. Just going home and lying flat on your back can help to relieve the stress of the strain of the muscles.
Is that our new normal, Dr. Corsa?
It's unfortunately going to be our new normal. It really is a scary society out there. That's all we're doing, hours on end. And we also often need to mention the thumb, texting thumb. I'm seeing a lot of people
with arthritis.
Arthritis, and this is the second most common area. It's arthritis of the thumb from texting.
Second most common area.
Absolutely. It's a real problem. These kids are getting multiple pains in the thumb, and then it starts to radiate up in the arm. They're like, what is wrong? It's definitely from the iPads. There's no such thing as books anymore. No one's going into regular books. Everyone's using smart tablets and iPads.
Wow. Now, we've been talking about physical therapy as a way to alleviate pain and injuries, but up next, we're going to switch gears and talk about how it can help patients with neurological conditions. You're watching the Health Channel, all health, all the time, on South Florida PBS. If you have a question for Dr. Corsa, you know what to do. Pick up the phone and call 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes or submit questions for the experts. Don't go anywhere. That's great.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions, like how much vitamin A is good for you and how much is too much. If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least two of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Strength training is important for all of us, but when we're talking particularly about women, it becomes crucial, especially after menopause. If you think about how we use our muscles, we use our muscles for everything. We use them during our daily lives, to go to the grocery store, to carry our kids, to play with them, to do stuff around the house. The more we prepare our muscles for these activities and the more conditioned our muscles are, the better off we will be, and sometimes even prevent injuries from those daily activities. Also, after menopause, when we lose the protective effect of estrogen as the levels go down after menopause, then it becomes more important, because strength training and resistance training can help maintain a healthier bone mineral density and sometimes even be a part of the treatment for osteopenia and osteoporosis. So I think resistance training for women is really important, it's critical.
Welcome back to the Health Channel, All Health, All the Time. I'm Kathy Buccio. And with us is Dr. Lisa Corsa, physical therapist, manual osteopath, and athletic trainer of Premier Therapy Solutions. If you have a question for Dr. Corsa, please call in using the toll-free number 855-796-4475. Now, when it comes to physical therapy, we often think of it in sports setting, but someone can also have a traumatic injury and it could be a neurologic condition. So what is the difference when treating a patient who has a neurologic condition using physical therapy?
So it's definitely a different approach. Okay. So I treat a lot of patients that have had a stroke or a CVA, Parkinson's disease, multiple sclerosis, ALS. So a lot of these neurological diseases are really creeping up now. It is a completely different approach in the fact that we use a lot of neurological electrical stimulation to reprogram the muscles that have been damaged.
Now, some of the different conditions require physical therapy. So can you talk a little bit about some of these conditions that require it?
So with Parkinson's disease, physical therapy is key. We stimulate the muscles with our special electrodes and machinery that we have. We use lasers, these kind of hot and cold lasers that help with stimulation of blood flow. With our stroke patients, when they don't have their arm working properly or they can't walk, we do a lot of balance therapies, gait training. We put them on specialized harness treadmills to help them walk again. It's a different approach than the orthopedic therapist or the weekend warrior athlete that's trained a muscle. These conditions have nerve damage or brain damage, so it's retraining the brain.
Now, I do want to talk more about rehabilitation for stroke. And as many people know, after having a stroke, patients have a lot of issues physically, and I'm sure you see that, Dr. Corsa. Now, these are the effects of the stroke. I want to go through them. Patients come into your office, and this is what we're seeing, correct?
Absolutely. Oftentimes, they will come in thinking they had a strained foot, when in reality, it was a stroke. So I have clearly assessed and said, you need to go see a neurologist right now. Difficulty swallowing is key. They just not talking well. They might be slurring their words. Extreme fatigue. The foot can actually start, the muscles don't work well. They can be tripping or falling. That's called foot drop. Diffuse muscle weakness. It's not just in one limb, but diffuse through the entire body can occur. They're not coordinated. They can't button their shirt anymore well. Zip the zipper. That could be a sign of a stroke. Definitely some pain, either, it could be facial pain, could be arm pain, clearly paralysis or plegia, which means weakness. They're not able to move the limb. Or they could be having a seizure. Some mild seizure, silent seizures are signs of stroke.
And it's just little things. I remember from my father, it's cutting the steak. Can't use his where he lost sensation. You can't still cut some of the
Correct. Functional basic activities, pouring your cup of coffee, opening the jar of water is a real problem.
Absolutely.
And relearning these tasks can be done. These patients can get better.
Absolutely.
There's definitely hope for stroke patients.
Now, another neurologic condition that I want to talk about is Parkinson's disease, and we've mentioned it several times throughout the segment. And we have a list here of some of the symptoms associated with Parkinson's disease. Now, Dr. Corsa, can you talk about these a little bit?
Yes. In my practice, I am definitely seeing more and more patients, younger and younger, getting diagnosed. I've recently seen a 45-year-old, 51. This is definitely not the disease of the elderly. It's happening all ages. So they start with these just abnormal tremors. They're unexplained. It could be just a finger or something we call pill rolling. They're starting to pick up their pen and they can't write. They get a very slow stiffness in the morning. They walk stooped, hunched over. They can't maintain their balance. They're not coordinated. Then when they walk, one foot goes over the other. Very generalized, diffuse fatigue, and there are changes in their handwriting. They can't write a check anymore. I will tell them you must go see your neurologist, and oftentimes they're diagnosed with Parkinson's.
And you actually have a very high success rate for getting Parkinson's warriors on their feet. Again, without mentioning any patient's name, I know there was a specific patient that came in a wheelchair, and they're walking.
Absolutely. I have had some wonderful success with Parkinson's disease. I do a very unique intensive program, a lot of high intensity working out, some of the boxing therapies you've heard in the news, which is fantastic for Parkinson's. We really do repetitive exercises. We get these people walking again, back to their life. It's been really, really fun.
That is amazing. Now, in your practice, you do a therapy called LSVT, which means LVT Big? Is
Correct.
That how it's called?
It's an LSVT Big program.
Big program.
It is a patented program and unique that was started years ago, and I am a certified teacher specifically for Parkinson's disease. It's a fabulous program. There are instructors all over the world that can help and assist with patients with Parkinson's. Some unique movements that we do with these patients that helps them reduce the tremor, feel less stiff, and absolutely improve their balance. And you can look up on the website instructors all over the world.
So now what is the approach to this technique?
The approach is to do big movements because with Parkinson's patients, their world gets very small, slow moving gait. They don't talk well. They can't pronounce, their voice is very low. So it's moving large movements. That's where the term big comes. In physical therapy, we teach them how to take big steps.
The emphasis is always big in anything, speaking, moving.
Correct. Moving, reaching far, grabbing the cup of coffee far, taking long steps. It is very effective and absolutely can really improve this disease.
LSVT Big, and you've been doing this in your practice now for how many years?
Many, many years, over 5, and I've found dramatic results.
Unbelievable. Thank you so much, Dr. Corsa, for being on the show. What a segment. So be sure to join us next time on the Health Channel. All Health All the Time on South Florida PBS. Follow us on Facebook, Twitter, Instagram at All Health TV, hashtag All Health TV, where you can get health tips from our experts like Dr. Corsa and see what's coming up on the Health Channel. You can also visit our website, allhealthtv.com, to submit questions for the experts or watch videos from previous episodes. I'm Kathy Buccio. We'll see you next time.